Well, Jamie and Corey, I want to thank you so much for having a conversation with me today. And as I was thinking about the conversation we're going to have, I'm like, it's great to talk, but it's also not always great to talk about this topic because we spend a lot of times not talking about this
Mm.
topic. And so, before we even delve into the conversation of talking about our mental health, Jamie, I'll just have you introduce yourself, let our listeners know who you are, and Corey, I'll have you do the same as
Mhm.
well.
Yeah, so Jamie Haverl, and I serve as the executive director at the Iowa Healthiest State initiative. And we have a number of campaigns, and one of them happens to be our Back the Black campaign.
Yeah, my name is Corey Deion Lewis. I am a health equity advocate, and I advocate through my work at Safety Net Hospital here at Broad Lawns Medical Center, and as the founder of the Healthy Project, which is a health equity focused media company.
Yeah, well, thank you both for that introduction. And I guess we're going to delve into this conversation of mental health. I really want to hear from you, Jamie, and then Corey, your involvement with this as well. But just kind of like what made Iowa Healthiest State say yes to this? I think there's lots of initiatives you all are covering, but what was important about this initiative?
Yeah, so I think, just looking at the research and the data around mental health in general and recognizing that maybe some of the materials or the content that we've created for our Make It Okay campaign, which is really focused on reducing stigma, wasn't appropriate for Black Iowans, right? So recognizing that, is there an opportunity for us to step forward and help build a campaign that was created by Black Iowans for Black Iowans, just to ensure that the message and the language and the visuals and that it's a campaign for their own community, and that we could provide the space for that and the opportunity for the committee members to come together and really build that campaign and for us to step aside.
Yeah, and to be asked to be a part of that committee with some of the heavy hitters from all over the state, people that were already doing the work, like Brianne Ward, some of those that are really doing that work, and just it was exciting and refreshing to know. Okay, we kind of it was kind of like a blank canvas for us to really talk about what do we need to talk about when it comes to mental health for our community. So it was just an awesome experience, and not only was I able to give my input and help in any kind of way, but I also learned a lot too through the experience. So it was awesome.
Yeah. Talk a little bit about like kind of why are we getting into people not wanting to talk about their mental health? Jamie, I don't know if there's anything maybe you all have looked into to speak to that, and then Corey, maybe some of the things that you all have found in that, but kind of what is the stigma behind you don't want to talk about our mental health?
I mean, I think there's a long history when it comes to mental health, right? So it's kind of that invisible disease for a lot of people. And for a long time, many generations just, you had that conversation behind closed doors, or you maybe didn't even have it behind closed doors with families, right? And like, there really wasn't like, is it really real, if you want to say? It's so different than physical health, although sometimes you don't see the physical health, but there's a better understanding, right? Like, we've talked about physical health. I mean, even when I was growing up, you learned about physical health, but you didn't learn anything about mental health, right? And so I think it's just got generation after generation, you continue to not talk about it. It's, that's no one else's business. They don't need to help you. And we really need to kind of tear down a lot of those structures around that for all communities across the state of Iowa, to be honest with you. But I think Corey can talk about some of the within your own community. What did that look like and how that was different?
I think Jamie hit it right on the head. It's culturally, when you think about it, I can only speak for well, my family, and I don't want to speak for the whole Black community, but it's almost like it's a stain on your name if you talk about mental health. So it's nobody else's business. Or speaking specifically for my family, it was ain't nothing wrong with you. Have you talked to Pastor yet? So it's kind of, you know what I'm saying?
Exactly what you say. That's like, can't pray this thing out here, y'all.
Yeah. So it was almost like embarrassing to even bring up that you don't feel well. So as we did in the Black community, you're strong. You just fought through it. But at some point, you don't got enough energy to keep fighting, and bad things happen. And there is statistics out there that suicide rates in the Black community are rising. And so through this committee and through this project with the Iowa Healthiest State, Make It Okay, it was important for us to have the conversation to let people know it is okay to talk about it, because if we don't, we know what can happen.
Right. And how do you think this campaign really resonated across the state of Iowa? Because, I know that there's Black folks in all different parts of the state, right?
Mm-hmm.
You're trying to bring a message that really kind of speaks to the representative of that. I think sometimes being here in Des Moines, I know I have a tendency to always focus on Des Moines and the greater Des Moines area, but you're talking about spanning a campaign across the state of Iowa. How do you, make sure that as you're doing that you're really trying to resonate with many African Americans across the state?
Yeah, well, like anything, it takes time. Like when you get stuck in a way, or like we were just talking about, when you're stuck with, if you grew up 30, 40 years of being told you need to talk to your pastor about how you're feeling, or it's not mental health, it's the devil, whatever, a campaign that you've heard about for a week or two or a month is not going to change anything.
Right.
So it's going to take time for people to understand, to really get comfortable. It's going to take people hearing it from people that they trust. It's going to take consistency from those who are doing the work. Now, throughout the state, those that, some of it is preaching to the choir, like, the people who agree with it understand it, but now it takes those people who agree with it to talk to somebody who's like, I don't know about this. You know what I mean? And so it just takes time, patience, and consistency.
Yeah, and I think that's what I like about the campaign, is that when you look at, I can remember last year on the publication, there were all of these faces, but these were faces of individuals that I'm like, oh, I know that person, and I know that person. And so hopefully across the state, someone seen someone that was like, okay, I'm going to listen to what they have to say because I can resonate with that person.
Yeah, I'll let you speak, Jamie. But I want to say what was so cool about that, I was on the cover of that.
Yes, you were.
But what I will say about that, Dwana, is like, if you look at all those people that were on that cover, one, maybe two were in mental health in the profession. So that was very powerful to say, like, hey, there's somebody that is an executive or this company or does this, but we're talking about mental health. So it wasn't just you hearing it from somebody that's doing the work professionally already. So I thought that was very cool.
And that was really intentional, I think, as part of putting the committee together, is to make sure it wasn't just coming from mental health professionals, right? Because just recognizing that, they bring a great value to the conversation, but we also wanted to hear from a wide variety of ages and different type of professions, right? And so I think that was really important in help building the message, is so that it could resonate with individuals that maybe, see it at their barber shop, or individuals that work in the C-suite, so you had this variety, and you had different age groups that have such different perspectives and different backgrounds. So it was great to see 15 really different experiences, I would say, come together to create a common message that could be used, and hopefully you can find some place where it can resonate within someone else's life. I think is really important as building that campaign.
Yeah, and I think it just goes back to representation matters. And we forget about that it's nice to look and go, oh, I see someone who looks like me, and oh, they're telling that story that I can relate to. When you talk about the pastor, I mean, how many times have we been told the pastor can take care of it, you go pray about it, it's all going to be okay, and it gets a little bit past that. So what do we say to people when we're talking about your mental health and how to take care of yourself? I feel like there's so much going on in the world right now that's impacting our mental health, from our families to our workspaces, to even this world of politics and laws and things that are happening. It seems like there's so much attack on mental health. How do we start to address our mental health in our communities?
So I have a few thoughts on that. One is a challenge for people to, when someone's talking to them about their mental health, or you see the struggle, to not talk but listen. Right? Like we can do, especially I'm a helping heart. I want to help and I want to fix.
Yeah.
Right? But sometimes you don't need me to fix nothing. They just listen. And I think that is important, to just listen and just to be there, and to guide and do whatever you can to make sure they get the support that they need. But sometimes people just need to know that they have someone that they can talk to. And that's not going to tell them, well, what you should do,
So it was me.
Yeah, and it's all in good. It's all, you got a good heart about it, but just sometimes you just gotta shut up.
Yeah.
And just listen and be there for somebody. But also, what I would say for that person who is struggling, who doesn't feel like they have somebody to talk to, who wants to do something, that's the first thing that I am excited about, is that they want to find help. But there are resources on the Iowa Healthiest State website. There are resources out there in 2024. It's a quick Google search.
Yeah.
So it's like, there are resources. You either got to take that next step yourself, or go to someone and say, hey, I want to help, but what do I do? And they can guide you that way.
Yeah. No, that makes sense. Did you want to add anything, Shane?
No, I mean, we talk about this a lot, right? I mean, we have 2 ears and we have 1 mouth, and we tend to use our mouth a lot more than we do our ears, right? And especially in this space, a lot of times it's just knowing that you're willing to listen, and that you're hearing them out, that you're not, we like to fix people,
Yep.
right? But sometimes we don't need to fix people. It's just knowing that I have a trusted person I can talk to about this and my struggles, and that I'm not going to be shamed or,
Right.
ridiculed because I'm sharing the struggles that I'm having.
Right.
And sometimes that's all someone might need.
Right.
And sometimes they might need more. And so how
Yeah.
is it that you can help identify those resources?
Yeah.
Now I want to ask you, I'm going to get in your business a little bit now with this next question, okay? And if you don't feel comfortable answering it, it's fine. But how do you all take care of your own mental health? I think sometimes we see people doing things and folks are go. You're doing great work with what you've got going on. You're doing great work with Iowa Healthiest State. But people see people and they're like, oh, they got it together. They're doing great. But I always like to tell people, like, we're all, we all got to figure this out to, like, stay afloat. And I just had a day yesterday. I was like, it's time to center yourself because your mind is getting way further than where you need to go right now. So bring yourself back. So what do you all do to help yourself with your mental?
Let me go. I'll go. I allow myself an hour in the morning. So I'm gone. Once I go, I'm gone. Right? Like, there's just a lot going on. Got a lot of things going on. If I don't allow that time in the morning for just peace and quiet, to gather my thoughts, to understand what's going on through the day, then it would just cause more anxiety and more stress. But one thing I will say, what I also say to myself, and this is more of, I'm putting my health coaching hat on, but it's called motivational awareness. So there's 3 questions I ask myself periodically throughout the day or in the morning, and it's, what am I doing? Why am I doing it? And where is it taking me? And yes. And so sometimes those questions are very hard to answer, but I promise, if you're able to go through that process, and once you get to that 3rd question and understand where it's taking you, that really kind of helps set the tone for my day or for my week or for my month. So I always preach that to patients or the people that I serve, and that really helps me with my mental health.
Thank you.
So physical activity is always, movement of some sort has always been something that helps me. I think as I've always been a recovering workaholic, as I call myself. And I always have to remind myself to, like, step back. I love those 3 questions. Those are something I should incorporate, to be honest with you. But just breathing sometimes. I have found that when I get, either really worked up or I've got stressful things that are happening or just a chaotic day even like, it's okay to just step back and take 5 minutes and just, like, pause. I think we get afraid of, like, we're such a go all the time. And I've learned that I really do have to just take, 5 minutes isn't going to kill me, right? Like, and I think recognizing what is truly important. I mean, I used to work in disaster work, and I would say, there are things that, like, we had to respond quickly when we were in the midst of a disaster. And so even I tell the team today, it's like, sometimes you just have to evaluate, is this life or death, or can it wait? It's important. The work we do is critically important, but sometimes it's just like, I'm not saving lives right now. I'm not working in an ER. I'm not working on an OR table, right? Like, I'm not delivering babies. So, kind of just check myself, like, yes, this is important, but is it that important to get myself so worked up that I can feel my internal stress or my heart rate going up because of that? It's just simple things sometimes. It doesn't always have, bubble baths are great, right? But who has time for those sometimes?
Yeah.
Make some time for them.
Yes.
I get it.
I agree.
Yeah.
Yeah. Sometimes you just got to turn it off, right? Like it's
do.
okay to step back and
You do.
turn it
No,
off.
I think it's good for people to hear from others, like, oh, they do some things, and also maybe it's something that they can glean from. Your 3 questions, I'm like, I'm gonna go back and write this stuff down so I can start asking myself, because we get so busy with the
Yeah.
kind of the bustle and the busy of the day, and the demands that get put on us, right? There's so many demands that get put on us. So going back to the campaign, just is there some activities coming up? There are some things that we're going to visually see. What will we get to see in this month? And just kind of recognizing the work that you are doing, making sure we're touching people across the state of Iowa, and then how can we find out more information if we're needing some help with our own mental health?
So throughout the month of May, I mean, we're really focusing on the magazine's going to have a lot of great content. So I encourage people to definitely pick that up so they can learn more. The resources we have available on our website are always available. You'll start to see some billboards around. You'll see some information even just on like the DART buses here in the Des Moines area. Really anyone can take the materials and drive with it how they wish. And that's the intent. I think that's the beautiful part of the Back the Black campaign is the materials are all available, right? And so if you see something, you're like, oh, I want to share this with my friend, my neighbor, that's the networking and the grassroots component is what's going to spread this message the fastest. It's not always seeing it on a billboard or even in a magazine. It's really making sure that, you know, Corey, or you're sharing it with those closest to you, because when we talk about mental health, it's so personal, right? And there is still that stigma. And so there's that fear of vulnerability to talk about those things. And that's what we want Make It Okay and Back the Black to really be about, having accessible resources, materials, so you can just even have that conversation. So hopefully people will start to pick it up, can go to our website at iowahealthieststate.com, and you'll see the Make It Okay and the Back the Black materials all available, and there's no cost to download those or even contact us and let us know if you're looking for materials, just to have that conversation with family, friends, coworkers, whoever it might be.
Great. Are there a website that we can go to get that information?
Yeah, so if you visit iowahealthieststate.com, you'll be able to find all of the different resources available.
Okay, so let's talk a little bit about the Back the Black campaign. I know last year it was Make It Okay. This year it's Back the Black. Talk a little bit about the coming up with that theme and kind of what's involved with it.
Yeah, so probably almost 2 years ago, we brought together a committee of Black Iowans to really help us, you know, figure out how do we take our Make It Okay campaign,
Right.
which was really meant for, I'm going to say general population, right, kind of mainstream, and making sure that the content and the materials
Right.
and everything would resonate with Black Iowans. And so that committee was really given, I would say, just the platform to figure out what is it. It's not going to be called Make It Okay.
Right.
It needs to be called something else. And they're really the ones that came up with the name of the campaign and really the material. So, you know, they knew what Make It Okay was about. They had all of that materials. But how do we kind of turn it into something that's going to actually better resonate with the community that we were trying to reach as well? So I think it was an exciting opportunity for them, because they really were kind of given a blank canvas to say, okay, what would you want to have be created to be able to actually talk about mental health within your community?
Yeah, no, and I like the word Back the Black. When I hear it, to me, what resonates is, you know, really supporting the work of Black Iowans, what they're doing, being there to, as we were talking about, listening to Black Iowans and the concerns that they have, but also being supportive of Black Iowans in their work, rather it's, you know, if they're out here doing their own business, if they're out here working within, you know, larger business spaces, but being able to actually make Black Iowans feel valued and heard. So those are the things that resonate with me when I hear those. So it'd be interesting to see how it resonates with other people across the state. I think that's really, really great work. And shout out to all the committee who's doing
this
their
wouldn't be
amazing work.
possible without their expertise and really the time that they committed to make this. And I think, you know, they had a lot of ownership in that, because it was like they knew it was for their community, which was really exciting for us to watch. I mean, this has probably been one of the most rewarding projects I've ever worked on, to be honest with you, and I really didn't do anything, you know, which is kind of fun. You because we gave the platform.
Right.
I remember when the committee came together, like, so what's the budget? And I was like, my team always says, well, Jamie never says start with the budget. Start with what do we want to accomplish, and then how do we find the dollars to get there? And that was the same response I gave the committee, and I think they had never really entered in that kind of space. And the fact that I didn't sit in their meetings as they had these conversations, but I also didn't feel like I had a lot to offer. I'm not a Black Iowan, right? And so, like, what perspective do I bring to this conversation? Nothing. And so it was really giving the platform for them to create something for their own community. And it's been fun to watch them really take it and own it, even though it lives under the Healthiest State brand and name.
Right.
But it's really for Black Iowans to own it.
Yeah, no, and it's great to hear you say some of those things. I think sometimes people get involved with the very best intentions, but sometimes their intentions are evil spoken of when they try to immerse themselves in it so much that it no longer becomes about what it was intended to be, and it ends up becoming what you represent. So I think it's really great when you said, like, yeah, I'm not a Black Iowan, and so I don't need to be in the room while you're planning and getting things together. Like, I trust you all through this, and we're just here to be kind of the people that are like, and here it is. So, you've done it, and here it is. Now everyone go support the work. So I think that's really great.
It was a great learning experience for myself and our team, I would say, and something that, I think this type of model that we created with this campaign, we hope that we can use components of that model as we work with other communities, because I think we have seen, like, we could have easily just said, oh, let's just switch out pictures. So photography looks the same, or, it represents that community, but that's really kind of misleading because it doesn't really represent the community, because the voice, the words, the conversation, and even the level of where a community is at when it comes to mental health is very different as well. And that needs to be really brought into the conversation and not just, I guess, implied that if mainstream is here, does that mean all of our other communities at that same level? Maybe not.
No, I think that's great. Let's talk a little bit about Iowa Healthiest State. I'm sure people have heard me say it now for the last couple of years, Iowa Healthiest State, and they're involved with this. But talk a little bit about the work that you all do outside of this work that you're doing right now, just kind of who you are and what you're doing across the state of Iowa.
Yeah, so outside of our mental health work, we focus on some food insecurity work. So we have a program called Double Up Food Bucks. That's a SNAP incentive program. So individuals who receive SNAP or EBT benefits can go to a participating location. We work with some of the fairways, the Hy-Vees, farmers markets, some cooperatives as well, and they purchase fresh fruits and vegetables and earn up to $10 more to buy more fresh fruits and vegetables. So really trying to increase access to those healthy food items. Kind of the other side of that, our food insecurity is our produce prescription program, and so this is, we're working with Broadlawns here in the Des Moines area, as well as primary health care, to prescribe fresh fruits and vegetables for individuals who are diabetic or pre-diabetic, recognizing that access to fresh fruits and vegetables is really important in managing chronic health conditions or even reducing those chronic health conditions. So that's an opportunity for patients to get prescribed fruits and vegetables. They get some education around fruits and vegetables and how to use them over a 6-month period. And we've seen great results in individuals seeing improvements within their health outcomes, which is also exciting. Another campaign that we manage across the state is called 5210, Healthy Choices Count. And this is really focused on 5 or more fruits and vegetables, 2 hours or less of recreational screen time, 1 hour of physical activity, and 0 sugary drinks with a focus on more water. So we work on, part of it's just having a simple campaign. Like if we could all work towards 5210, right? We'd be a really healthy state, number one. But also I think it's just, those are great habits for all of us to work towards. I don't achieve them every day, in all honesty, right?
Do I.
But it's a goal, right? Like, okay, oh man, I haven't had any vegetables today. Maybe I should try and get 1 in there or 2 in there. So part of it's just having common language. And so we work with healthcare providers, we work with schools, early care sites, just to know what the 5210 message is, so that everyone's kind of hearing it, because I don't have a marketing budget like some other places, right? And then we work with those places as well to look at, like, what are policies that are driving some of those choices or those unhealthy behaviors. So, example might be within a school. Do we always have to celebrate all the time with cupcakes? Maybe we can celebrate in other ways, right? Because we don't need probably need to eat a
Probably
cupcake
don't need
every
one
single
all the
day.
time.
Yeah.
Yeah.
So, trying to work with them to understand, like, how do we help build these healthy
Right.
habits in our kids so that they can achieve long-term
Right.
outcomes around health and wellness and
Yeah.
really live their most healthiest life in the future as well. So,
Yeah.
and we do a number of events throughout the year as well. We have two conferences that we host, one in the fall, one in the spring. We have our Healthiest State annual walk, which is probably what most people
Yes, that's what I was
recognize
going to
us
say.
from.
I was like, I think it's the walk that I'm
Yes.
thinking about. Yes.
Because that's been going on for, oh man, I think this is our 14th year that we'll
Wow,
be coming
okay.
up on doing that. And
Yeah.
so walks happen throughout the entire state of Iowa. It's free to participate. It's
Right.
a fun way to just remember how great, easy, and fun walking
Yeah,
can really be. And,
exactly.
so we try to do a bunch of activities and events throughout the year. And we have a lot of partners who also do things locally
Right.
that maybe my staff's not at, but they're promoting either the Make It Okay, the Back to Black, the 5210. They're helping promote information that might be coming from us, but isn't directly coming from our staff.
Yeah. Well, then tell everyone how the website so that they can just check it out, see everything, all the information we talked about today with Back the Black, Make It Okay is all housed on your website as well. So, and then all the other things that you all are providing and doing. Tell them the website that they can go to.
So they can visit iowahealthieststate.com and you'll find everything you want to know about all the work we're doing, the events, way to participate, way to get involved, as well as all of our social media channels. You can find all of that information too.
Perfect. Is there anything else you want to share? I want to make sure I'm not missing anything that maybe we didn't cover with Corey or anything like that.
I don't think so. I think
Okay.
you covered everything.
Okay.
Yeah.
Perfect. I want to make sure. Well, thank you so much for taking
Yes.
time
Yeah.
to
Well, thanks
talk
again for
and go through all of this. I appreciate it. You and
working
Corey
with
both.
all of, yeah.